care partner is a key member of the healthcare team, as we sort of established. So who are the other members of the CAR T-cell therapy healthcare team?
Yeah, it's really important to recognize just how big that team is. We always have the CAR T physician. That one's easy. Physician is usually supported by nurse practitioners or physician assistants and nurses that are part of, again, getting all of the appointments organized and all of this. We tend to have CAR T coordinators, both to make sure the paperwork and the insurance side of things are done, the clinical appointments. But it's also important to recognize, as we were talking about coordination, transportation. Sometimes patients need to stay close to a center that's far from home. So social work and all of those folks become very important. And then there are a number of different steps with different drugs. So our pharmacists are very important. And then beyond that, any of the other doctors that keep our patients, optimized. So if there's a cardiologist, a pulmonologist, an endocrinologist, all of those physicians working together.
As you're preparing for the CAR T process and you're meeting with patients and their care partners, what sort of advice do you give them sort of about the process as you're sort of setting the stage?
Yeah, I think it's very important to ask questions and never think there is a bad question or a stupid question or whatever. There are no limits. I know this is a completely new language, and I think it's important, even if you've asked it before, keep asking until it's clear and don't ever think you're bothering us or anything. I've heard that, and it just doesn't compute on our end. We are here to teach and support. Secondly, to take time. I think it's really important to not think, oh, I'll do this and then I'll run off and do something else and then I'll come back or have other commitments. Really allow both the patient and the caregiver protected time to be together and to just go through everything that this journey requires. And for the caregivers to look after themselves. I think it's really important when you're trying to take care of someone who has the label of patient. You need to take care of yourself as well so that you can then be of use to the process.